Senator Richard Burr and 3 other lawmakers introduced health insurance legislation yesterday calling for universal access to affordable care. Senator Burr joins us now. And, sir, now, you've introduced a new plan, and I'm just going to try to paraphrase it, if I may, in the interest of time. You would tax health care benefits and give credits, tax credits, to families who buy their own health insurance. In essence, that is the plan. Have I got that right, sir?
Pretty close, Stuart. We would tax health care benefits received from an employer as ordinary income, but every American family would receive a reasonable tax credit. So for those families that were receiving a tax obligation, they'd also get a credit to pay the taxes on that.
So, Mr. Senator, the problem, though, is not just universal coverage. The basic problem is the cost of providing health care, the cost of going to a doctor, going to a hospital, the cost of drugs. I haven't heard any proposal from either side of the aisle that seriously addresses the question of how do you get costs down. And I put it so, your solution, sir, does not get health care costs actually down.
Well, I would disagree with you. I think, Stuart, we're the only ones that do attack costs, because getting costs down in health care can only be done one of 3 ways: incorporating prevention, wellness, and disease management. They're the only 3 areas. You can't attack that unless you have 100% of the American people in the pool. And I think what we do is we transform the American healthcare system from one that triggers when you get sick to one that actually invests in prevention, wellness, and disease management. And if you look at the uninsured or the self-insured companies across this country, Safeways and Dells and SAS, they're all companies that are self-insured that have driven their healthcare costs down because they focused on prevention, wellness, disease management, a healthier employee base. That's what our bill accomplishes.
If you're going to cover all of those who currently do not have coverage, and you have universal coverage in America, under your plan, what's the net cost to the taxpayer?
The net cost to the taxpayer is our plan is budget neutral. It doesn't require one additional taxpayer dime. We believe that a country that spends 17% of GDP on health care, that at 17% it's unsustainable. So we've got to begin to do the reforms that drive health care costs down. This is a comprehensive, bold approach to doing it.
Okay, Senator Richard Burr, Republican, North Carolina. Thank you so much for joining us, sir. We appreciate it.
Delighted to be with you.
Thank you.